Imagine this: a young woman sits in a doctor's office, her hands trembling, her thoughts a storm she cannot control. She suffers from anxiety, depression, or perhaps just an inability to conform to the expectations of 1940s society. The doctor examines her, nods, and prescribes the latest miracle cure, a lobotomy. In a matter of minutes, a thin, ice-pick-like instrument will be hammered into her skull, swiveled back and forth, and remove forever the part of her brain responsible for her deepest emotions. She will leave the hospital a different person, but at what cost? This was not a dystopian nightmare. This was reality. And for nearly 2 decades, the lobotomy was hailed as a medical breakthrough, before it was exposed as one of the most horrifying chapters in psychiatric history. The birth of a medical horror. In the early 20th century, mental illness was poorly understood. Psychiatric hospitals were overcrowded, and treatments were primitive, ranging from electroshock therapy to cold water baths and even restraints. The medical community was desperate for a cure, something that would ease suffering and make psychiatric patients more manageable. Then came a man named Dr. Egas Moniz, a Portuguese neurologist who, in 1935, developed a procedure called the lobotomy, what we now call the lobotomy. Moniz believed that mental illness was caused by faulty connections in the brain and that by severing these connections, a patient's symptoms could be alleviated. His procedure involved drilling holes into the skull and injecting alcohol or using a wire loop to destroy brain tissue. The results were chilling. Some patients became docile, less agitated, even euphoric, but others were reduced to vacant, emotionless shells of their former selves. And yet, Moniz was awarded the Nobel Prize in Medicine in 1949 for his work, cementing the lobotomy as a legitimate medical practice. The ice pick revolution. But the true lobotomy epidemic began when an American psychiatrist named Walter Freeman took Moniz's procedure and turned it into something even more terrifying. Freeman wanted to make the lobotomy faster, easier, and more accessible. So, instead of drilling into the skull, he devised a horrifying alternative. He took a sharp, ice-pick-like instrument and inserted it through the corner of a patient's eye socket. Then, with a small mallet, he hammered it through the thin bone behind the eye and into the brain, severing key connections in the frontal lobe. The entire procedure took just minutes. He called it the transorbital lobotomy. And for a time, it was considered revolutionary. The rise of a nightmare. Freeman was not just a doctor, he was a showman. He traveled across America in his lobotomobile, performing ice-pick lobotomies in front of medical students, journalists, and sometimes even family members of the patients. He believed he was curing mental illness, giving people a second chance at life. By the 1950s and 60s, new psychiatric drugs, such as Thorazine, offered less invasive treatments for mental illness. The lobotomy, once considered a miracle, was now seen for what it truly was, a brutal, irreversible destruction of the brain. Freeman was banned from performing surgery and died in obscurity. The lobotomy itself was largely abandoned, though in some parts of the world, variations of it were still performed as late as the 1970s. The chilling legacy. Today, the word lobotomy is synonymous with horror. It serves as a cautionary tale of how desperation, ambition, and a flawed understanding of the human brain led to one of the darkest chapters in medical history. But it also raises a question: what treatments do we consider groundbreaking today that future generations might look back on in horror? Could it be certain psychiatric medications? Electroconvulsive therapy? Genetic modifications? The history of medicine is filled with once-praised treatments that later proved disastrous. The lobotomy epidemic reminds us that science, for all its progress, is still fallible. And when medicine prioritizes convenience over compassion, the results can be terrifying. If you want to uncover more shocking medical mysteries, subscribe and turn on notifications. In the next video, we'll explore another disturbing medical experiment that was once praised, but is now buried in the shadows of history. Stay tuned.